7th, 2024. This is a work session of the Billings City Council. For anybody who's not familiar with our process, there's a copy of the agenda on the back. Work sessions are a little more informal than our regular business meeting. We don't make regular binding decisions. It's an opportunity just to trade thoughts and perhaps give direction to staff. It is October 7th, so I would like to just acknowledge that this is the 1-year anniversary of the attack on Israel 1 year ago. So we remember the people of Israel and the people of the Middle East today in our thoughts and prayers. Before we move into item or to public comment on any item, whether it's on our agenda or not, Chris, you got anything in the way of preliminaries?
The circle back 12:25 this afternoon, you received an email from Debbie that was in response to last week's special work session. Simplified all 14 individuals who came and filled out the form or shared enough information that we could go back, look at their records and circle back to them. We have been in contact with all 14 of them, been responded to. We've added around 20 plus people to the phone tree. That is allowing us to have a scenario where folks are no longer in the queue for long periods of time. I acknowledge they're most likely going, that first person they're going to get is a person who's not going to be able to get into the system and necessarily resolve all their issues, but they can get their information, talk to a real person so that we can circle back with them. We have about 500 combination calls and emails that we're working through to get back to folks on, and we've conducted one phone, not interview, but conversation with a potential audit group. We have another one tomorrow, and what we're trying to discern there is, one, do they have the capabilities to do the work that we need done, and secondly, do they have the capacity to do it in a time frame that'll work. So we're working through that, and as was stated last week, we will, that draft scope of work, you'll see it before it's finalized so that you can weigh in and give us any feedback to make sure that scope is correct. And that's what I would say, that is the update on the utility bill scenario. Thank you.
Okay, very good. Thank you very much. Then with that, we'll open up for public comment on any item either on our agenda or not. There will be an opportunity for public comment on the specific items when we get into each item later. But if anybody needs to go and they want to comment on those items, feel free now. Is there any public comment on any item at this point? If so, please come to the podium. No one is coming to the podium, so we will close our public comment, initial public comment period, and move on to our first item, which is our Substance Abuse Connect Crisis Response Unit update. And Zach Tarakitis and Assistant Chief Banfield, I think it's yours. So however you want to take us through this.
Great. Thank you, Mr. Mayor and Council. Appreciate your time this evening. Like the work session format, so we can dig into this a little bit. Just so you know, we're going to present some information tonight, some updates, so forth and so on. We leave tomorrow morning at 6 a.m. We'll be in Bozeman for 2 days for the State Crisis Summit. It's only the second year for this, but a lot of what we'll be presenting, I think we're going to be learning a lot tomorrow from DPHHS and from all of our partners around this entire model. So even beyond that, we'll have more information coming up. So that is tomorrow and Wednesday coming up there. So.
And just so you guys know, the fire chief is on. He, like some of you, is ill, so he's online. But that's why Chief Valdez is not here tonight. So he's with us via Zoom.
So they're going to get this shared. Great. So as we know, in October, and actually quite a bit before that, in 2022, there was a decision that was pre my time on where the really early front end part was, but inheriting that part in 2022, there was a partnership with Rimrock, the City of Billings, and the Fire Department to start a mobile crisis unit. A lot of what we're going to present is how that unit actually is part of a much larger system and how that integrates into our system for behavioral health, substance misuse services here in the community. Right. So what is the Crisis Now framework? We know that if you fall off a ladder and break your leg, you're going to call 911. Somebody's going to show up, and they're going to take you somewhere to get taken care of. And that cost of care goes up, but so does the quality of care in that circumstance. Similarly, this is a model that's been adopted across many, many communities in the United States on how to create a system that would treat behavioral health in the same way. Someone to talk to, someone to respond, and a place to go. We were the first community in Montana to have all three of these elements in place. Currently, our crisis center has been around for 18 years. What that crisis center is used for is evolving as we see behavioral health needs evolving. So we've been working on that end of the system. In 2022, nationwide 988 was rolled out. It was a suicide prevention line for a long time, but then it also became our crisis call line. Our crisis call center is in Great Falls. Voices of Hope. They cover a huge swath of eastern Montana, but 988's been in place since 2022. We have data that supports all of this stuff we collected for the entire coalition. Mobile crisis team was added with the partnership, and again, some of the guidelines of helping people by adding this system, meeting individuals where they are to get crisis relief quickly, resolve the situation, reduce people going into the emergency room departments or hospitalization in areas that really aren't going to help them in the circumstance that they're having. And so that was the addition of the mobile crisis. We're going to show you some options for how mobile crisis does get rolled out across different communities. Even here in Montana, our partner cities across the state are running mobile crisis in a whole variety of ways. And that's a conversation we have at least quarterly about how those different things are happening. As we rolled out the mobile crisis here locally, again, a lot of contact with these other partners on how they do it. Before we go into how we're doing it here, well, let me introduce these models and I'll talk to you about how they kind of get rolled out. So mobile crisis unit, a CRT, crisis response team, and other areas solely made up of mental health professionals and or paraprofessionals, peer support specialists, behavioral health aides. That's one model that's done in Missoula in partnership with the fire department if they need emergency services added into that. But they work primarily with a behavioral health specialist for that partner. Co-responders, embed a mental health professional with law enforcement to behavioral health calls. Probably one of the lesser used, and I don't think I attached it to your packet, but there is a national study that was done in 2023 on these across the country of how they're rolled out for every program in the country, of what their model is, how it responds, so forth and so on. Behavioral health community paramedicine. This is the closest thing to what we have here, is that we have an emergency response personnel on with our behavioral health specialists to go out into the community. So you're kind of hitting people where both their needs are, with their behavioral health situation and then also with their physical health situation there. A consultant, mental health professional, paraprofessional. We're seeing this in some of our rural communities where they're using telemedicine as we've gotten more comfortable with that post-COVID, where the mental health professionals on an iPad or a phone, and they're able to kind of comment or help de-escalate a situation. Not ideal in a lot of circumstances, but necessary in rural communities. And finally, the CIT officers. The CIT program's been going on in Yellowstone County for many, many years. It's been facilitated by the Crisis Center with both our sheriff and PD. And it's really empowering our police departments to be able to recognize the circumstance that they're in, provide them with some de-escalation training. It really isn't just a training. It's supposed to be a movement, because in a lot of communities, this is their approach as well, is let's get our police officers trained up, because once again, we want to avoid taking people with a mental health situation to jail. And we know that they are rolling out because there's a potential crime, and they're ending up experiencing more and more engagements with behavioral health issues. Roll back to that one more time, sorry. So again, in Montana, we see 3 or 4 of these different models rolling out. Bozeman has a mobile crisis unit. It's 100% outsourced to a company out of Arizona, and they run everything. Different results, because they don't have the services that we have that can interact with our mobile crisis unit across the entire spectrum from 988. 988 can also refer people to 211, so people can self-refer themselves into systems. So when you're in Bozeman and they're having to pick up stuff that they just don't have available. Up until 18 months ago, I mean, their behavioral health system for youth was pretty much non-existent. They're currently partnering with the Yellowstone Boys and Girls Ranch. That's part of the new engagement with Youth Dynamics. They'll be partnering up, and they're expanding into Bozeman to provide youth behavioral health services that were, again, not really there. So in all these communities, their models reflect what's needed in a lot of ways. And then, but we can still share a lot of information about what best practices are for Montana. Great. Considerations, and these aren't new things to consider. These are just considerations that I think were taken into play when we talked about a mobile crisis unit, but I think across the entire spectrum, these are all of the considerations we talk about on a regular basis. Warm handoffs and follow-up, I mean, the care coordination piece in our community is across all types of providers, hospitals, et cetera, et cetera. So these considerations were taken into, I think, effect when we were talking about mobile crisis, but they're still in place, and how do we roll this stuff out? I think locally for us, I can go down to the safety piece, is a lot of the calls we'll see in the data piece here in a minute come from our police department, and there's got to be an engagement of making sure the scene is safe before we're bringing on this other team who are not there for law enforcement situations. So again, all these considerations they can be put in place prior to this. Timeline, this is just a quick timeline of kind of how this all rolled out for those of you who weren't involved, like myself, but this early 2022, partnership initiated through RFP. October 2022 was the council meeting where the partnership with the Rimrock was approved. Crew development meetings began January through June for about 6 months. It was just a lot of back work because the situation we're dealing with is the state was not caught up with this either. There was a lot of issues with how things were going to be billed in different ways. So the state was developing this as we were developing this. And so those conversations we're having up and down and sideways with all of our partners throughout. July through September, the DPHHS rule for Medicaid was still pending. So it was prior to us starting in October, we were pretty confident that that stuff would be in place and we'd be able to bill. It was 11 months later before that actually became available. And so that stuff was still happening through that. So again, most of it was still taken care of with city and state grants. Crew operating with, started in October through December 2023. That's when we started the pilot phase of this happening. Again, all of it was still being paid for through grant funding. We were actually shifting funding from other crisis areas into a bucket to make sure these services were taken care of. So nobody was going down just because of financial reasons. Crew continues to operate January through April. I think there's a key point here. Rimrock didn't get paid for 6 months of work until they continued to provide services, because even though we were shifting money into that bucket, getting paid for that was providing, again, very difficult. I think other folks are experiencing similar things with the state for certain circumstances. It was absolutely true here, providing 6 to 8 months of services without only getting paid twice, which put a hitch into maybe the feeling about how valuable that could have been to them. But May to June, again, continuation of that. And then finally, in September 24, the rules for the Medicaid and an approval of block grants to allow all mobile crisis services to be billed. We were just working on Medicaid. At that point, they also put in place additional resources for anyone who receives mobile crisis services, because currently there's 2 insurance companies, Pacific Source and Blue Cross Blue Shield, pretty positive that's who it is, that are looking at being able to reimburse for mobile crisis services. Otherwise, the state has put money in for anybody who is insured but not covered and uninsured. And then the Medicaid rules are now approved as well. So this one's a little tougher to see here, but I think really important to this is that, I mean, we had 474 unique individuals who, in those 8 months, received services that did not exist prior. And I think there's some key elements, and I'm not looking at it, but I know some of this data of just, I mean, 62% of our calls were initiated through PD. So once again, our police department's recognizing when they're dealing with the situation, which is not criminal behavior, it's a behavioral health situation, and they're de-escalating while calling on our crew to get that circumstance handled so that we're not taking people to jail who are just having a mental health crisis. 85% of the time, 85% of the time, people's situations being reduced on site. They're not being transported to the next level of care because we're providing the appropriate level of care on the scene, which is huge. Same thing with 988, is that if people are resolving when they make that phone call, those are numbers that are not showing up in our community. Now, the numbers that are using 988 in our community currently are really low annually. It's not a lot of calls that are going to 988. We currently have a marketing package put together for both 211 and 988. What we're going to discuss in the next 2 days when we go to Bozeman is, will that overwhelm our partner if we start marketing that to our community, and will they be able to do a good job? And so a lot of stuff that we've worked through there. Again, connectivity between 988 and 911. The ideal is 988's able to dispatch into your community, so they get a call from an individual who needs service. They realize they cannot de-escalate. They should be able to dispatch our mobile crisis. Again, it's a work through that we have to keep working on. Our 911 system was being rebuilt with a new system, so we didn't really push on that very hard with our partner in Great Falls, because again, I think the call volume they're taking right now is probably about where they need to be. So before we roll out the marketing for all of that, we're giving them time to kind of catch up. Or do we need an alternative situation here locally with a call center? Similar, Gallatin County has much higher numbers, but it's because their call center is also in Gallatin County. So they serve a region, but if you look at kind of how they respond, their 988 numbers are different than ours significantly based on population, but they also, it's kind of a local controlled deal. So we're kind of, again, systemic approach to what's going on here. There's a lot of other data in there, but I think those are kind of the key elements that are unique to us, is that, again, PD's making the call. We're getting off of those calls. The PD's getting off calls 7 minutes earlier. So we gain that time back into them getting back to a crime call versus a mental health call. And so that was a key element. And I think also that reduction of people not going to the next level of care is a hugely important part of people staying in their home environment, care coordination, picking them up where they are and getting them attached to the service they need, not just transporting them to a service that may A, cost more, and B, not actually be the service that they need. So I think that's the summary. This is the care management piece on there. You see some higher numbers in that just because it's probably dealing with family members and people that weren't necessarily the initiation of a call, but they were somebody else that was in the circumstance that we're also taken care of through the care coordination on scene. Is that the last? Great. I'll take some questions on operations. I do have, this is the revised budget here. This is same numbers, different format, a little clearer. I realized when I started printing it out, I'm like, if they have to look at this, it's not going to be that much fun. So I'll hand this out to you in a second. But operationally, again, understanding that the Crisis Now model is, it's Montana, the state of Montana is going to be doing the Crisis Now model from now going forward for behavioral health intensively. We've heard that indication, we understand it, there's a lot of money flowing to it, and it's going to continue to flow to it for quite some time. And I think tomorrow we're going to find out even where some additional resources for the behavioral health future generations money is probably going to dump into that also, but we don't know that for sure. But they have secured up some of the things that were missing for these first 8 months that we've had to deal with on the fly of dealing with budget-related issues. So, any questions on
Zach,
operations?
let's hear from the chief first, and then we'll have questions once you guys are done with your
I
presentation.
really don't have much to add. We worked that PowerPoint together. And I had sent out a couple invites for you guys to get into some weeds of the operational pieces that you think are missing in there. And so if there's more time for that and we want to do that offline, I'd sure like to have an opportunity to do that. Or if you have questions tonight to see how our side ran and what our successes were and what our failures were, I can answer some of that right now.
Okay, so you're just ready for questions?
Yep.
Okay, I'm going to turn it over to Councilmember Kennedy because he asked first, and then I'm going to just ask you to address the 800-pound gorilla that's in the room, which really isn't in the room, which is Ruben Rock Foundation and what happened to him. So,
well, that's my question: is who is offering the mental health side of the piece? I mean, you just explained to us that hopefully all these funding sources are in place now, but who is the provider, and do they take care of all of the paperwork and everything to get Medicaid and insurance reimbursement and everything from the state? How does that work?
So currently, right now, just to let you guys know, we do not have a clinician on the crisis response model. It's not going out right now. We have the 2 EMTs. We've made some scheduling changes and brought them in. We're not accepting any new patients and attaching them to any calls right now. What we are doing is we're working through those case management pieces with our patient roster that is still left. So, and to be honest, a boatload of that work is done on the backside. For every 20 minutes we spend with one of these patients, it's about 3 to 6 hours on the back end getting them into the services that they need. So that's what's going on with those EMTs right now, but we do not have a clinician. The unit is not
So
operating.
Chief, I'm taking from you, you're doing it all right now.
We're doing all what's left over. We're not doing anything new.
Okay.
And I think on that, even in identifying, I mean, even from 2022, when the contract was signed with Rimrock, there's even been certification changes at the state level. I mean, there's a crisis provider certification that has to be had. I mean, Rimrock did go through that process. I mean, there's things that have adjusted even through that in the timeline, because again, the model is new to Montana. In identifying the next level partner, it's again, looking at all of our models, what our preferences are, and how we want to see this operate in our community.
So I guess my question, and then Councilmember Boyette, is where are we at? And I'm putting words in your mouth, but you can correct it, is I don't want to say we're back at square one, because we've learned a lot from having 11 months of experience, but we don't have an existing partner. And even the model that we've been following is up in the air, kind of depending on what comes out of this conference and further thinking. Can you tell us what the next step will be in this whole process?
So we have been working behind the scenes because again, we had to respect that the city had a contract. But at the same time, I'm working on coalition work, which is a system. And so understanding that this was coming and working through that fairly recently was, even today at 4 o'clock, met with a private provider who has interest in being partnered with this circumstance, who's very tied into our existing system. I think in the models that were presented, the reason that particular model was important to adopt into Billings is the community paramedicine approach. You're going to hear that there are different models across Billings, but that's because across Montana, but that's because those community needs are much different. Like I was talking about in Bozeman, they just don't have the service providers that we have online. For us, having the EMT professional with a behavioral health specialist really solves problems for us as a community, because we know right now our fire department is responding 85% of the time to physical health issues, not fires. And so to have a lighter unit that has that professional on there, you're able to handle somebody's behavioral health situation, but also look, is there something going on with their physical health at the moment of contact that also needs to be addressed? And sometimes that may need to be done first. We have a much larger community. We have an aging population. Our behavioral health issues are ranging across all demographics. And I think that is a good model for our community. So continuing with that will be great. Would the other models work as well? They're going to help people with behavioral health issues. We need to stop putting people with behavioral health issues in jail. And we need to taking them to the ER where, again, the emergency room is going to do their small little piece, and they're going back out into the community. And that's where this is very preventative in providing a higher level care at a lower cost, because we're not sending out $1 million fire truck with 3 firemen on it who still are not behavioral health specialists, who may then just call for someone else to transport. And whether we're seeing that in downtown or we're seeing that throughout the community, I mean, I think that's a good model for us to pursue first, but if there's other limitations, and I think that's, I don't want to get into a position where we're asking for anything tonight, because it's not really an ask. I mean, I think it's an engagement. Well, how does the city want to engage in behavioral health? And that's really what we're talking about, is where do you play? With across the model, 988 is funded by federal and state dollars. Right now, Mobile Crisis here is being funded by the city in grants with a partner who gets paid from those grants and billing Medicaid. And then Crisis Receiving is paid for by the county at the Crisis Center and federal and state dollars through billable services. So right now, all of our communities playing at different portions of the system, and that's hugely important. Bozeman they just cut a check $60,000 a month from county commissioners. The county is paying 100% of the costs for mobile crisis. Until the billing gets caught up, they knew that they just had to have that in place. So not right or wrong. What's right for us, I think, is kind of key. I think the fire department, getting to know Jason and understanding the operations and seeing our numbers, community paramedicine is going to be hugely important as we see the challenges at our healthcare systems of not being able to attract employees. I'm getting way out in the weeds here, but like not be able to attract the employees, the costs, et cetera, et cetera. We know healthcare is going to be very different for us in the next decade. And so I think mobile really does provide us a chance to address especially behavioral health in a different and an important way that isn't unique. We're not making this up. It's done all over the country.
Thank you, Councilmember Boyette. Councilmember Joy Owen Gulick. Councilmember Neese, okay.
Thank you, Mayor.
Just about everybody. We'll get to you eventually.
So the mobile response unit, there's 2 units, 2 red ones that drive around town, and apparently they're very busy. I look at this, why should this doesn't even make sense to me to pencil this out. 11 months, they had 474 people. It's not even 2 people a day. Why should I continue to fund this when there's not enough people it's seeing? Seems like doesn't make sense.
How many of them were being seen before you had mobile crisis? 0. So, I mean, looking at the
We're already
budget,
paying for the fire department to see that already. I'm just saying, this is an additional funds for only, not even 2 people a day. This system doesn't seem to work.
but I think the average, it's a new system. So, I mean, it's working only at its capacity. I mean, it was an unfunded program that was supposed to have been funded by the state well ahead of time. That again, if that funding is not there, I mean, we can pull a lot of different metrics into this of, but to average it out on 2 calls a day, I mean, there's a lot of other data that goes into that because, I mean, we can talk about the interaction with PD. We could talk about how many people didn't go to jail because mobile crisis responded. I mean, there's so much more to it that in an 8-month period when it was operating, not 11, 8-month period, I mean, there's a lot of stuff you can pull from it. And bang for your buck is really, again, how does the city participate? We're going to have mobile crisis in Yellowstone County. It's really how is the city engaged in that and how are they part of it? I think that this model is the best, but.
Okay, Councilor
The
Boyette.
only thing is, I would agree with that if there would have been 500 people a month or day and we didn't get to them. But we're not even, the calls, there's only not even 2 calls a day. It doesn't seem like it's very important to the city or the police department or the fire department if that's all we're getting. If we were getting 50 calls a day, only able to go to 2, I could see the difference. But this doesn't seem to pencil.
And to be honest, that the call volume that was brought up on there is the context of patients that they saw and spent time with and referred to services. Those calls don't also show the CPRs that they spent with the families. They don't show the calls that are unbillable that they spent with the parents of the teens that were killed in a motor vehicle accident. So there's around 600 to 650 to 700 calls in there. That's the actual amount of times they've responded. Those are basically the billable calls that meet that billable part of this process. What we need to do in our community is also reduce risk. The first time we have an Elijah McClain issue here, and it cost the city $15 million because we didn't want to spend money on the front end of this, because we don't think it's valuable on the front end, that's not the way to do business. We have to reduce risk in this population and support them as much as possible. Get them to the backside of this. And like I said, so what if it's 3 or 4 people a day? Remember, it's 4 hours of the case management pieces that go to fix them or move them. We move patients out of our community that were part of our recidivism problem, that were part of the 90 population that were spending $10 million in our activity. I know in 1 quarter we moved 11 patients, some to Boise, some back to New Mexico. We just took somebody that was moved back east, that was part of a probation and parole issue here, and got them services in a vet center back there. So not only are we helping our patients that are from here, we're helping the patients get back to core services and core pieces and family members that are going to be more supportive than being in a city that you have no friends and no family at.
And I think when you talk about the client base, I mean, we've had the conversation with school district too. I mean, mobile crisis absolutely responds in other communities to their schools situations for youth who are also in crisis. And right now, because of budget issues, if we're going to cut teachers, you can't add behavioral health. But the conversation is how much more behavioral health are we going to keep putting into the schools? And I'm like, what's needed But the reality is who's paying for that? But if you have a crossover in these, again, in 8 months, I think it's very difficult to say, there's a ton of people that don't know that this is available. And there was misinformation, even at the state level. The original grant that you guys accepted a few weeks ago was put for marketing and outreach, $550,000 for marketing and outreach of a program that we hadn't yet operationalized to capacity. That didn't even make sense. And then they've since flipped that to realize the money needs to be for operations. You can't market something you don't do well. Hence the reason we're holding back on 988 and 211, because if they can't handle the call volume, if it does kick up, we got to have the capacity for it. So I personally didn't think it's just a timing of getting it out to the right services and the people in need. But
Okay, Councilmember Joy Owen, we'll work our way down.
Thank you, Mayor and Council. I have a question about the Crisis Now model for behavioral health that you're talking about is really going to be the model for the state. And what I'm kind of interested in is, where did the model come from? And in terms of the sustainability of Crisis Now model, how much is the federal government really spending, really putting into if this model becomes sustainable? That's where I think we all struggle with, is not that we don't see, may not see the need for it, but a lot of us see the need for it, but then it's the sustainability that really causes the trouble. So what is the Crisis Now really based on? Is it based on research? Is it based on modeling in other communities? And then the sustainability of Crisis Now? Thank you.
yeah, I think the model is based on our physical health model. Again, like I mentioned before, if you know, it took 17 years for 911 to roll out across our country and be adopted all across the country as a known entity. All of our kids at age 5 know to call 911 when there's an emergency, just standard practice. I think the modeling is that you show, again, that people with a behavioral health issue know where to call. They're going to get these first lower cost of services that will hopefully help them resolve the issue that they're having. It's always going to require a variety of levels of investment into that service. And I think we see that in our physical health service all the time. Ambulance services, fire departments, all of those things are funded locally often, and then also regionally, statewide, grant funded, et cetera. Right now it's been grant funded for a long time in Montana because it's so new here. I think the key element is what it's also based on is going to where people are located to get them the services. Getting someone with a behavioral health situation that's part of 3 different systems. This is a real thing that just happened at the Billings Community Foundation the other day, where this gentleman that's sitting outside, 30 years old, he's part of 3 of our systems right now: criminal justice, behavioral health, and physical health. And he has 3 different care coordinators. And we're going to pay for him for the next 30 years. He's a healthy 30-year-old, maybe longer, because he doesn't have a way out. His mental health issues are holding him back from, how long are you going to have that ankle bracelet? I don't know anymore because I've been to court so many times. He's not from here. He landed here, got stuck here, and we're paying for him in this current circumstance without resolution for a really long time. And so I think it's a matter of identifying how to start reducing the recidivism rates across all populations, because we have plenty of room to grow with all of our populations right now to get this done. So from a sustainability standpoint in the state of Montana, I think we're going to see this bump of everything that's happening at the state level with the resources we have. But we have to say that the goal isn't the input, it's the outcomes of increasing the quality of behavioral health in our communities, because we can't keep up with what's going on. I think it's pretty evident. And the money that's being infused into the system right now isn't forever money. So it's $300 million, which we're going to burn through pretty quickly at the rate that we're dealing with behavioral health issues. So I think there's a lot. Locally, I think our mobile crisis unit for the next 2 years there's a lot of resource attached to it at this point.
Councilor Owen?
Thank you, Mayor. So I'm a big proponent of the crew, and I will continue to be a big proponent of the crew. But I think at this point, we should chalk up the last 2 years to a pilot, lessons learned, and stop defending the data. Because you're exactly right to say we can't keep up. And these numbers it's not going to work going forward. We were talking before the meeting started. Today, the Yellowstone County broke ground on a pre-arraignment holding facility, which will give our officers sitting in the back of the room there the ability to arrest people who are posing a danger to public safety in a way they cannot right now. But you're also right to say some of those people don't belong in jail. That should be our last resort, which means we have to have a robust, large, at-scale diversion strategy that can be offered at every point on the sequential intercept map. Pre-arrest, post-arrest, post-booking, before initial appearance, after initial appearance. We have to be able to have multiple ways to go to a person who has substance abuse issues, behavioral health issues, mental health issues, and say, are you ready? Are you ready to go to treatment? Is today the day you get your mental health issues addressed? We have to. We have to have this at scale. We cannot keep piling initiatives when we have people being victimized across our community, people suffering across our community. So we've done our pilot. We've learned some lessons. I'm looking at the letter you submitted to Yellowstone County for the mental health bill. That's about $1 million. We've got diversion at 50,000, prevention at 150,000. These are not great numbers. So how do we get to a system of diversion that reduces jail population, sorts people where they need to be, threats to public safety, incarcerated, people who are having occurring issues of treatment? How do we do it at scale so that we start moving the needle in the community? And I know the easy answer is more money, more people. But let's stipulate to that, and how do we get to scale?
Well, I mean, I think it's a challenge for the providers. I mean, you're going to hear pretty soon, we've been working with the COC as well to make sure we're inclusive of all populations because of all the co-occurring conditions. And I think, first of all, we got it pretty real, and I think people are getting more comfortable with understanding what are our current capacities, because we don't have that tallied very well. Once again, most of the data that's collected is collected for inputs for grants. And we had the conversation last week with the state where we've collected data for the crisis diversion grant for the last 5 years. Where is the data that somebody who's new to the system can access to pull back to say, well, what has this looked like as we're trying to figure out how to scale up? What you're saying, Great Falls was in the news last week for that exact conversation. They have to reduce. This is related to one very clear metric, reducing the population of people in their jail. And one of two of their diversion solutions is mobile crisis and using the system to make sure that people aren't ending up in the wrong system. We know our systems don't talk to each other. Again, I'm preaching to the choir, all this different stuff, but all of these systems are moving around one another, and we just haven't gotten to a point yet where there's efficiencies across all these systems. We have to keep doing the work. You can keep throwing money at it. I mean, if we don't have the people to do the work and you see reduced services, for example, at Rimrock, I mean, as a partner, I think it was just overwhelming to their system as they've made different choices on what types of services they're going to provide. And this just happened to not be one that fit the bill, I think, moving forward. So,
Mayor, can I follow up quickly?
Sure.
So the clock's ticking. Ground broke today. Construction began today on this short-term holding facility. And I want to work with you guys over the next year to get something that's meaningful in place. But I'm concerned that we don't have a widespread enough urgency. So how do we break that down? Like, we can't be sitting in the firehouse waiting for calls to come in. We need to be out. We need to be proactive. We need to be breaking down the communication barriers, whatever they are, whatever the cultural training issues. We have to start just chipping away at this. What do you need today to start doing that?
In my opinion, I think you guys need an ordinance. You need an ordinance that's going to force these groups to work together to start creating pathways for these patients. It's no different than inside a hospital. Okay, I worked for Billings Clinic for a number of years. You come in the front door, you get referred to X-ray radiology, next is lab, next is the other piece. You're just not doing it in a building. And we have to be part of that as a community. So an ordinance to force people in that process that are in your community that are receiving Medicaid and Medicare monies and monies from the city, that's what should be happening. If there's an investment into that, then there has to be groups that need and are forced to work together. I've been to Adult Protective Services meetings. I've been to Adult Resource Alliance meetings. I've been to a ton of services, and none of them are talking together. And part of that is some of this has to do with the HIPAA issues and what we feel comfortable with, and some directly has to do with people siloing things that don't need to be siloed in our community.
It related to the, I was just with the county commissioners on Thursday at their discussion, in that, we dug into that, because I was very happy to hear them say, we need data showing the outcomes of the efforts for the money put into it. And I'm like, that's great, but we provided, you've approved unanimously metrics that we then tracked over 2 years. And you said, build a road from here to here with these materials in this timeline, and we exceeded every single metric. And the response was, well, we didn't get our bang for our buck. The reality is as a community, we've got to decide what is acceptable for us to reach, because I can come in and tell you what we're doing. I can tell you what we're trying to do and what we're going to try to do. The problem is when you get a whole bunch of opinions on what's acceptable and what's not, then the system's got to go back and be like, well, we're not going to be able to get resources for this because it's not related to the work. It's related to opinions of what's going on. And that was really the condition that I was appreciative of, the fact that the commissioner said, we're going to give you a little bit more time here as a coalition to present options for us that we think that are suitable, and we're going to stick to those things for a longer time. But you also need to switch the gears. We can't keep just showing the data, and our providers are very good at saying, well, look at all these numbers, this is why we exist. It's not acceptable. Just existing isn't enough. Like, what are the outcomes that we all accept as a community that we're all shooting for to reduce crime in our community, to raise healthier kids with better behavioral health situations? We're dealing with it in all of our systems, but they're disconnected.
Okay, so just to put a point on this,
Yep.
I believe that if we issue people money, we can compel them to behave in certain ways, but if we don't, we can't. And so I'm pretty certain we can't write an ordinance that says if you get Medicaid, you have to participate in the system. That's not going to cut it. So I guess what I would ask, without asking for a response, is just as you guys are working through the conference this week and talking, if you start seeing models of forcing mechanisms or gentle compulsion, please share them, because I think a number of us would like to work on them, but I'm quite certain if we start mandating state agencies to participate in city activities, there will be a conversation about that. So interested in whatever models you have.
Very good, thank you. Councilmember Gulick, Neese, and Kennedy?
It was last week, a couple weeks ago, I had the opportunity to meet with Rimrock folks, and we talked about crew. And so just hearing from their perspective, why the model didn't end up working for them. So, it's just their perspective. But I think one of the things I recall, and I just guess may want you guys to comment on, is that the mental health professionals aren't trained for trauma situations. So being an accident, a scene was really traumatic for them, and there's not a mechanism for treating them as well. And so I think they were thinking the consultant type model that you presented, where they're sort of there via like an iPad or something like that, is something that worked better for them, because they could also be back at their back of their office doing other work until there was a call, right, to be on. And I guess the other piece, they weren't sure that it was the right fit with a EMT, that, more of the calls were related to police department calls, is where they had more in common with an EMT. I guess I'm curious, how many calls was there a need for both an EMT and a behavioral health, behavioral health specialist? Maybe Chief Benya, if you could.
Yeah, it's,
do that.
The referrals came in from PD prior to any part of the other CAD system asking us to go to as a medical provider. So then the fire truck didn't go or the ambulance didn't go. That's part of our CAD system. Our CAD system is built off PD first, fire second, EMS is third, based upon the call number and how it comes in. It's 40%. We're generally coming from the actual 911 side. So 60% was generated from the police department. Other places such as Spokane, they run both models. They'll put a clinician on a police car, and they'll put a clinician, not with an EMT, with a paramedic. And so that they can get drug referrals and things like that. They're starting to see that kind of market changes there. So again, back to a couple different models you guys can set policy to.
Okay, Councilmember Neese?
Thank you, Mayor. Chief, I think that's good to hear because it sounds to me like maybe that's one of the things we learned from the pilot is maybe we do need to look at our model, maybe not all under the fire, but we need police there as well. So that's good to hear. Thank you. I want to go back to what Councilmember Foyette mentioned because I was looking at this too. I was concerned that, a couple of calls a day and the units are sitting, and I drive by the fire station where they sit a lot of times, the crew, the white truck, the white vehicles in there a lot. And so it is concerning that, when I looked at this, I guess I'm not seeing the savings. We talked about, $1 million fire truck that's, doesn't have to go out. Well, they're not going out anyway, because there's not that many calls. If they're going to go out, it's very called. We have the MRTs really to kind of take care of that fire truck and not going out. But you mentioned that you saved an average of 7 minutes a day for the police. If there's only 2 calls a day, that's 14 minutes a day that the police are, back on duty. I guess I was expecting a whole lot more, but if the call volume is just not there, we're not seeing the bang for the buck for as far as really on the police side of helping to pay for this. We're seeing the clinicians now saying they'd rather use an iPad because they're not really, their time is valuable, and so they're sitting there doing nothing while they're waiting for a call, and so they want to use an iPad. I hear that and I think, well, what's best for the resident, the person who needs this? They need someone there, to have a live body there talking to them, have that relational piece there, not just an iPad. Again, I think it's really difficult to see how this is working, and I'm trying to figure out where my question is because I just don't. As I'm hearing more and more of these things. I do want to give you a little bit of information
as far as availability of that unit, and that started to wane as there was not a clinician available. Don't really want to comment on that. That's for something to Rimrock to comment on. And it's not our business to put that out there. I think that's their business to go ahead and share what happened with that. We went through 5 clinicians in 9 months.
Well, Mayor, if you don't mind,
Go ahead.
Quick follow-up, because that's something else I was concerned about is we looked long and hard for a partner, and we had a partner there, and we have a presentation from the fire department and not the fire department and Rimrock. I'm not sure why this is not a joint presentation. Why are they not here giving us all their data at the same time so we can hear everything and you guys can agree to everything what's going to be presented to us? And so I feel like it's a he said, she said now because they're not a part of this conversation.
I mean, it's interesting. I mean, because again, I think the meeting that was had prior to this was we were also unaware of that. And then, so again, it devolved earlier than I think that, I mean, it was a really challenging thing for the behavioral health side to tie into. And I think we were problem solving through understanding that this thing might not be able to move forward. It's a great point. I mean, I don't think we've tried to stay as positive to the community as possible of like, this was a pilot period to understand how does this fit into all of our systems? How does it integrate? Does it integrate? Is it the right model? It's what was selected. And it did. It went through a lot of different people. We talked about hiring practices, like how do we never get into this type of situation? We know that these personalities, we're not trying to do the virtual model to where people are calling through iPads. So you have to hire people that are open to going, not being in an office doing sessions. They want to be out on the street. And so all of this as a team was evaluated. You're right. The fact that we're not here evaluating it wholly, I guess, yeah, I mean, there's no real reason for it. There's not nobody needs to get thrown on the bus. It's kind of moving forward with something different. So,
Mayor, just one quick question then. I don't know who can answer this, but as you go to this other meeting, you're going to hear different models. Is it always the fire department that has to head this up? We have a city county health department here that could, I think is maybe best suited for that. Is there any reason why they can't run this whole program and then we support them in their endeavors. And that's the type of model that maybe we should be looking at instead of the city being, and the fire department being the lead on this. It may be someone like Riverstone or some other organization, and we're just going to support them.
I think the intention really was, and I think the timing of this meeting was kind of interesting for us as well, because we don't have enough to present to you to say which model would be best practice at this point. I don't think anything's off the table in any way. At 4 o'clock today, I met with a private partner. Did I already say that? Who's absolutely excited and already, but Riverstone, absolutely, as a partner, they're involved in everything that SAC is involved with, COC is involved with. I don't think anything's off the table. I think it's just a matter of discovering what really is affordable, best for the community, best for behavioral health, and moving forward with that.
Thank you.
Very good. Councilmember Kennedy and Councilmember Shaw.
You know, 25 years ago, we went to the legislature and we fought for the CIT training for the officers in the front line. That was supposed to be a jail diversion and diverting the mentally ill and not having the shootings and things like that with the mentally ill. We talked about the diversion of the mentally ill out of the emergency rooms. So that was a big discussion in this community. We talked about it, and finally with the hospitals and with the crisis center came about. And the crisis center was supposed to be the place to have the mentally ill and we get a lot of Greyhound therapy from Great Falls and Missoula and everywhere else. So I'm not really that concerned about their models. So, you know, with the crisis center, all it's functioning now is a low barrier shelter. And it's the same people night after night after night. So when are we going to finally address really the mentally ill in this community and the crisis situation and start addressing the millions of dollars we put into the crisis center? I mean, you keep on saying that you don't have a provider or you're looking for a provider or we need to find more monies and things like that. I have some real concern about this because the elephant in the middle of the room happens to be your crisis center here. And if we're going to function with a lot of money for a low barrier shelter, which the crisis center is doing, it's not really doing the diversion that the taxpayers paid for. And those are all taxpayer dollars, not county dollars. They're taxpayer dollars across the board. So why aren't you folks sitting down and working with expanding services of the crisis center? Get rid of the crisis center the way it functions today and put it in where it's actually going to do something in the community. Because I mean, the money is there, the function should be there, and they should be working hand in hand with the fire department and being able to take those on. Just because they offer shelter for 23 hours and 59 minutes doesn't mean that they can't follow up during the day, doesn't mean their services cannot be expanded. They've decided they don't want to expand them, but I have real concern about the city or anyone else expanding and asking taxpayers for more dollars when the function of what the crisis center is doing and a lot of your mental health dollars in this community aren't really going to address the problem. So why are we looking to solve all the mental health problems with the fire department when, you know, the hospitals and the mental health center are not jumping up the plate and saying, hey, you got it funded so we can bill the state or whatever. I mean, Rimrock Foundation, Rimrock dropped it and no one else is jumping up to the plate. So why don't we go back to the entity, which is the crisis center, that gets the government dollars and the hospital dollars and reinvent it and finally go forward. the idea of an ordinance to tell people they have to work together, I've been in this business for over 40 years. It ain't going to happen. You don't have a prayer in hell. So why not start looking how to reinvent the tax dollars we already have with the crisis center?
Zach or Chief, you want to address the role of the crisis center? Obviously, it's not a city facility. Those aren't city dollars. We got limited control, and you do too. But they're clearly part of the mix here. So
Absolutely. Well, and I think, Councilmember Kennedy, you can go ask the crisis center. I'm not the most liked guy in behavioral health in Yellowstone County. But what you just said isn't for this audience. I mean, I don't understand why we're not having those conversations with the boards of directors. Because the board of directors are a lot of leaders that do understand this and you have access to. And I have sat down with both the ownership team and the board of directors. And if you look at the letter this year, I mean, we got to the point where they were getting $1 million a year for a really long time. And we sat down with their board and said, operationally, this is not sustainable, and the county commissioners are no longer going to just do this without understanding the results. Now, they didn't accept the data that did show some results, so we had to restart on that end too. I don't think you're wrong about any of it. I don't think anybody denies that when the crisis center was started for a very different reason. Changing out of that reason also requires other capacities, and I think that even today we were talking through if MRM comes online with what they're proposing that they're going to offer, it should be taking the pressure off the crisis center. And I think the crisis center is actively talking about the fact that they have to be tied into this crisis. So we're having the conversations, but again, it was 18 years in the making, and I've been doing this for 20 months, not 40 years. So I think it's a matter of, I don't disagree with a word you said. I think it's a matter of taking it to the people that actually make those changes, because we can nudge. As a coalition, we can nudge and get it there. And I do believe we're nudging. And I believe that even the leadership there is responding in a very positive way. But it's been what it's been for a really long time. And I think if we're not going to adopt models that give us options to shift, we can't just say stop doing that, because that capacity has to get picked up somewhere else. And we don't have capacities to just take those things on. I mean, the leadership on our executive committees represented city, county, sheriff, PD, everybody. And I mean, the hospitals in April said, please don't ask us for any other behavioral health supports for the next 8 months. It's a capacity issue. And now they're getting caught back up, and we're starting to have better conversations about how the two healthcare systems are going to be able to pick up behavioral health.
And looking at the models, I think the model has to have in it the crisis center and a change in the crisis center. And I haven't seen anything with that. So.
It should be 2359, referring out to partners, and that's also a revenue stream that should have our partners responding to it differently because they're getting clients referred to them.
Okay, thank you, Councilmember Shaw.
Thanks. 2 questions. First, you said you had 5 clinicians turnover in 5 months, 9 months. From your perspective, do you think that was partially because it was not all part of one department because we had a partner? I mean, do you think it would have been more successful if it was all under the same umbrella, or do you think that didn't have an impact at all?
I would say it's a number of factors. I think recruitment and retention is a different world. If you come to us and PD, it's a certain type of characteristic that's going to fill those roles. And when you take office people who want to do iPad work and put them on a motor vehicle crash, it's not the personality you should hire for that.
Okay. I'm just curious if there's models out there that show more success by doing that.
I mean, again, I think it's resource-based in some circumstances. I mean, what's going on in, some of our smaller counties is dramatically different than, they could never support what we support. And I think that's the hard part for us being the largest community in the state is I don't think that we'll ever have a similar model, but same thing, we're talking about how do we get to 24/7? Well, it may be a normal mobile crisis for those 12 hours. The other 12 hours, we do put someone in with PD so that we're picking up the full 24-hour spectrum. So, I mean, all of these conversations we're trying to figure out the best way that it works here, whether it's money, staffing, all of those things. And
Great. I'll be curious after this conference, kind of what you learned from that. Second question is, I believe in this program. I think it's important for our community. What do you need from City Council right now? I mean, this is great information. Do you just need us to absorb it? You're not asking for anything at the moment?
And then let us go out and find some, kind of some models to bring back to you guys and pitch them to you. And you guys can then have those conversations. We can show you where funding is going to come from, grant, services, those kinds of things. And then we can have a real conversation after that.
Great.
I feel though our community needs to move forward with this and we need to have something solidified by January as we move forward in our community.
Thank you.
Councilmember Rupsis?
Thank you, Mayor. So Zach, Chief, most of what I had to ask about has already been covered, so thank you for that. But I did want to touch on something that last week when we were in the Substance Abuse Connect Executive Committee meeting, I asked, what's the breakdown between, those calls where an EMT was needed versus not? And I couched it with this is a stupid question, or it might be a stupid question, but what is that? And the response was, well, we're required to have an EMT. We have to have an EMT in order
For this model.
For this.
The model we
Right.
selected, it was the
Okay, so-
community paramedicine, so
Right.
you have to have the EMT involved, but not.
But, so I didn't get that out of last week's. There are options for models that we could very well take, have all the reimbursement possibilities and all that kind of stuff that do not require an EMT.
Correct.
All right, so what I'd like to understand is, I'm not sure I buy the whole argument that our community needs the EMT model because a lot of our fire department calls are medical related. I've missed that connection there. So help me understand, and maybe this is something that should be or is on the table still, that we'll be looking at models that may not require that. But help me understand that better. Why are we so focused on, well, we have to have an EMT there?
Well, in our community, it's not just the behavioral health piece plus the substance abuse piece. We also have a lot of elderly population in crisis. So they're making referrals using this team. And before the clinician sees somebody, in my mind, you need to cover risk by making sure they're not having a stroke, their blood sugar's low enough, their hypertensive crisis isn't going on, because those physical comorbidities that drive behavioral health issues are part of that. And if you don't grab that piece and move that away from the clinician as a risk, then you're looking at possibly unrecognized medical problems in that space. So of those 100%, 60% are generated by PD, 40% is coming in the medical side where they're doing a full assessment. They're even keeping them in a range of blood alcohol, which is the same protocols that we use for medicine for the crisis center. We've adopted those, had our physicians sign off on those as far as their care. So they can have a higher alcohol content and still be treated rather than transported to the ER. Because anybody above a certain high alcohol content, they don't have the ability to make those choices. But through good training and good protocol sets, they're able to do that, to not refer those patients. It's just one way to keep that recidivism backwards and to reduce risk.
Okay, thank you, Councilmember Joy, and I've got a question.
Thank you, Mayor and Council. This is a follow-up question to Chief Banfield. What is the risk to the city if we do nothing? Now, I don't think that, I'm not trying to predict any kind of response from council or anything like that, but, the Supreme Court has decided that mental health is covered by the Americans with Disability Act. So what is the risk to our community if the city council just says, we don't want to do anything? Thank you.
Well, you have to look at across all those demographics as we age, as our population ages. I'm going to say this again, we have 1,500 to 1,800 baby boomers moving to Billings, Montana to be part of the medical downtown, okay? So that's all the more 911 calls that we're going to be referred to and go on as that population ages. It's not just the substance abuse pieces or the other behavioral health pieces. So if we do nothing with that, that's one more phone call at 3 a.m. that we're sending a fire truck out on, a police car to do a welfare check. Police department's going to increase in welfare checks by a ton over the next 10 to 15 years, just in that piece alone. Then you look at the crime and diversion. You look at getting patients out of our system into other systems, moving those patients back home. What does that save this community? One, it's good for the patient. Two, they're not on our tax dollars when they didn't come from here. And we want to make sure they're cared for with wraparound services for their transport and they're received correctly. So we're not just doing like other communities in Montana, putting them on a bus and sending them to Billings. We're not doing that. And it costs dollars to do that. But we're reducing risk and making sure that those patients are cared for.
Well, and I think the other key part is just understanding our role in the state. I mean, the reality of it, we're talking, I had her on a phone call again today. There's a private donor out of Miles City that's trying to understand how she can help Miles City with her resources tie into our system, because that's just real. They're coming here. They do not have any homeless services in Miles City. It's 10,000 people. Not a huge number if you look at it broadly across our country. It's a small community. That is a giant community when you look at the rest of eastern Montana. They're coming here. We can either divert them back with a bus ticket and send them right back up there to nothing, or we take care of them and then do the care coordination to get them back into whatever is available, that's actually available at the time. But that's attracting private resources as well, because again, we love to say that we're the economic center of 500,000 people. We're also the center for 500,000 people for just about everything else. And I think that would be the miss is, but you said the city. I think it's just for our community as a whole and being part of eastern Montana is that we are the resource.
Thank you very much. I've got a question. I'll ask council if there's anything else, or any questions from people who haven't, especially, and then we need to open it for public comment and then probably move on to our next item. So a comment and a question. Comment is, I guess, based on our earlier discussion, I'm hoping any future model that gets adopted here has more detailed, granular data on just how time is being used. That'll always be an issue. So tracking time, not just by billable time, and because what we heard before was a lot of time goes into follow-up that is not billable, or perhaps time spent to collect and billing that is not itself billable. So tracking all that will help this body and you and the department know what resources really are available, how many FTEs are needed, what time is going into that whole process. But that's for another day, but that'd be my suggestion. The question is, and it's kind of back to the discussion about the crisis center. The hospitals were a major driver in the creation of the crisis center and continue to provide a lot of money because they know that it's cheaper to have people cared for at the crisis center than it is in the emergency room. The same is true for the crisis response units. And the statistic that was mentioned before, that it's 85%, something like that, that don't require transport, including to an emergency room. So I wonder if, as part of the future funding picture here, the hospitals would have some interest in making some contribution. It would not be fair to put all this on them or any expectation of that. But have we made any sort of approach to the hospitals? And if not, any reason we shouldn't when it comes to packaging future funding alternatives?
I mean, they're familiar. We haven't made an approach to the hospitals. I mean, I think understanding their capacity issues that were expressed early this year, don't ask for anything more related to behavioral health, was kind of the message we got. And now that that's circling back around, once again, I think we could add them to the list of folks to discuss. I mean, again, public health partners, everywhere else. I think it's just a tough time.
Very good. Chris, you had something, Councilmember Boyette, and then Councilmember Nice, okay, and then we'll try to move to public comment. Go ahead.
So,
Chris.
Mayor and Council, in answering your question, just a reminder, when we did do the RFP for the crisis response units, the hospitals were very much a part, through Substance Abuse Connect, of that RFP going out. So not to say, I'm not trying to predict what the future is, but they certainly were well aware. In fact, there was talk of, and I don't remember precisely if they did, whether they were going to put proposals in either individually or in some kind of a collaborative format with others. So just for the public's benefit and a reminder to you guys, the hospitals are a part of Substance Abuse Connect, and they were a part of and were well aware of the request for proposals when we were looking for partners last time, and I would anticipate they would need to be, like any potential provider, whatever the next steps are. Thank you.
Okay, very good, Councilor Boyd.
Thank you, Mayor. Chris, our budget, it's pretty thin. We got it kind of swooshed down. This project we're talking about is not going to happen tomorrow. So apparently we have 1 or 2 employees now, staff, that aren't doing a job they were hired to do. Plus we got a vehicle sitting there not being used for the topic it was used for. Do you have a plan to use those assets either one way or the other?
I don't, Deputy Mayor, Mayor and Council, I don't have a plan for you this evening. The fire department is working on that, just like tied to crisis response as well as their budget. And so that is certainly an issue that we have relative to that cost, because we are incurring the cost, I think, of 2 EMTs.
We are, but we're not. We've brought those, when we hired both of those, we went out for a COVID health equity grant. So the city has not, it's minimal. When you talk about hiring benefits and everything else, last year we brought in $127,000 in revenues, and this year for July on, we have $51,000. So those salaries have been covered. That actually never came out of the budget. Those reserves went back into somewhere, and then it was shown that that this was the cost.
Okay, thank you. Councilmember Neese.
Yeah, Mayor, since you brought this up, and I don't know all the involvement in these crisis center with the hospitals and that, but as was talked tonight, there's a desire, at least from this body, to just see that change more to incorporate into what's needed for the community. And if they're a major funder of that, or a big funder of that, that may be the avenue you take to them. And if we have a better carrot to help the community and help them prevent expenses in their emergency rooms, then maybe they would support our system versus that, and help them be a catalyst to help change and into this so it fits our community. So I'm just recommending that you consider that. I think it's really important that we do find a unified system. I wholeheartedly agree with what Councilmember Owen said, that we do need something in our community. It needs to be robust and throughout the entire system. We can't just pick them up and drop them off and expect them to survive. They're not going to survive out there. There has to be a system from end to end. And we just can't put them in jail and expect the jail to do something, because they will not. And they're going to come out of jail and they're going to be worse off than they were when they went in.
Okay, thanks, everybody. Let's move on to public comment. If there is any public comment on this item, please come forward to the podium. Just ask to keep your comments to 3 minutes. Tell us a name and address. Is there anybody who'd like to comment on item number 1? Okay, no one's coming forward, so we'll call that a wrap on item number 1. Thank you, gentlemen, for your work here, and for members of the public who are interested in this topic. We'll move on then to item number 2, which is our recreation program update from our Parks and Rec. Mike.
Good evening, Mayor and Council. So we had another successful summer of camps and programs for youth. I asked the Recreation Division to come and give us an overview as to how their summers had gone, and then kind of give us a glimpse into what's coming with their fall and winter package. And so with that, I got Dan McKinney, one of our recreational specialists.
All right, good evening, council and mayor. My name is Dan McKinney, a rec specialist here with the city of Billings. Going into my, I guess, fourth year. Couple of things on these pictures. A shout out to Allison Thompson. She is our customer service coordinator. And she created this picture up here. It's our billboard from the summer. She does a great job with everything. I really appreciate that. And then a shout out to Austin Bolin, who came up with Magic City Memories. That was kind of our hashtag slogan for the summer. So he's got his work cut out for him coming up this next summer. So kind of a game day schedule. We are all former coaches, so we like to work in practice plans and game day schedules. We'll do some quick intros. Kind of where we left off, if you remember, April 1st, we were here. Chris Martin, who I'll introduce here in a second, kind of went through the summer and kind of our plans. We'll revisit some of that, what we did to get ready for the summer with our hiring and getting the pools ready. Kind of a numbers wrap up, dog days of August, just where we were with registration numbers and different types of programs. And then kind of back to school, what we're doing right now and where we're headed in the future, the next couple months, and then when we get started in January. And then, as always, we'll do a press conference with questions. So I guess, sorry, Corey, if you go back. Just a couple things. So right after we were here April 1st, on April 8th, we had an Eclipse Day. Thanks to Jake Milliron, our community engagement coordinator. We had an event up there. Great partnership. The library came out and brought the bookmobile. We had glasses left over from the previous Eclipse. And then the STEM band there is from the Girl Scouts. So had a great event up at Castle Rock. I just wanted to highlight that. So rec staff, what we do, again, Dan McKinney, I have Austin Bolin here, another rec specialist going into his second year, and then Chris Martin, who's going into his fifth year, unfortunately could not be here tonight. But a little bit about what we do. We are in the same, it's an office, but we like to call it a locker room. We do everything together. So that's everything from planning and organizing all of our recreation programs from youth to adults. About 70 programs yearly, just throughout the year. Sometimes we have different seasons. We have a fall and a spring, or it's a continuous, getting ready for camps. Hire, train, supervise all of our staff. A lot of onboarding there, a lot of training that we'll get into. We also upload and create our rec track system. So that's where we can do our registration system, pricing, dates, times, coordinate that with the schools and our park schedules. Work with Allison on publishing brochures, flyers that just went out this week for girls basketball coming up, and tennis is elementary. So work behind the scenes there. A lot of coordination with School District 2, our park staff, and getting that all put together. Manage field rentals out of Poly Vista, North Park, and Central Park, which is a big thing. Just trying to coordinate with all the baseball teams, a lot of travel baseball teams, and then kind of oversee the operations of our aquatics managers and staff. We try to stay out of their way, but we hire them and let them hire the lifeguards and that stuff. But we oversee operations, and then working with bus drivers and our summer camp counselors in the summer. So that's a very, very small glimpse of kind of what we do day to day, but we are all in that same office and working together. Really good cohesive staff. And then I'm not at liberty to say, but I think Homer there is actually me. So we also portray as mascots as well when we need to. So we just do it all. And then where we left off in April, so kind of give you a glimpse into that summer with our adaptive recreation programs. Miracle League, Love Serving Autism, it just wrapped up, and then opened up for free swim at the pools on Friday for inclusion, special needs on those Fridays when we were doing swim lessons Monday through Thursday. It opened up Fridays to where we can have that brand new this year. All of our youth summer camps, all the way from 5 to 13-year-olds. That's a majority of the camps that we offer, just because when they turn 14, 15, they usually come and work for us. And we actually had that this year. We had, I think, 2 or 3 former summer camp counselors that were actually employees this year working in concessions at the pool. So very cool to see that when they came to interview. It was like, yeah, I was in adventure camp a couple of years ago. So some great stories and some connections there. And then this year, the big challenge was with School District 2 moving back 2 weeks, we had to be very creative in our last 2 weeks. We moved from a normal 11-week summer schedule to 13 weeks. So that last 2 weeks, you never know when you're planning this stuff in January if you're going to be able to have staff. So we created bonus weeks. We had limited capacity, went down to two main camps, and then we said, well, how do we expand that even more? We had some great partnerships with some outside instructors, martial arts camp, character design camp, kids in the kitchen, that we had instructors that were already kind of on staff in town that we could say, hey, we can run those bonus week camps those last 2 weeks. So had a great summer in that regard. And then just some other things to highlight with Rec to You. We'll get to kind of some of those numbers. Had a great year in Rec to You. Our special interest camps, Rocky Camp, character design, kids in the kitchen. We tend to kind of tailor down in the summer and focus more on the summer camps, sports camps, pool areas. Our adult sports kind of go down a little bit, but we still have sand volleyball out of Rose, soccer out of Emond, and then some adult tennis lessons as well. And then, of course, pickleball, big topic. So that's kind of the rundown from the summer where we left off and what we've been doing, and we'll get into some more specifics here in a sec. So summer prep and startup, this year, probably the most glaring number here for us and what we're most proud of is the 42 rehires that we had. So we had staff come back. I think we had probably close to 10 staff that this was their third or fourth summer with us. So very proud of that number. This year we had to expanded to 4 interns, just a great group of interns that we had. We couldn't run the summer without all their hard work and diligence. I do want to mention one of the gals in that picture. That was a training that they did this summer, where they could go and meet with other interns around Billings. A great experience for them and connect with Billings and other interns. But one of the gals was nominated as the MSUB Spring 2024 Intern of the Year. And in turn, she nominated us, and we were awarded kind of the MSUB Spring 2024 Internship of the Year, Employee of the Year. So proud of that. With the training, we really sat down and said, we're not doing enough for our staff to be prepared day in and day out. They have a lot. It's a 10-hour day, 40 hours a week, 30 to 40 hours a week, and really wanted to give them the tools to be successful and feel comfortable with being on the road, being at camp, dealing with kids, a lot of personalities. So we expanded that. We moved to a full day orientation with our camp. We brought in an outside speaker, Merge Consulting, out of Boston. She did a Zoom with us talking about inclusion and different behaviors and how to deal with different scenarios in camp. So very beneficial for not only us, but for our staff moving forward. So go ahead. And then Rec to You. So if you remember last year, pilot program in 2023, we were doing one camp or one site, one day, two different parks. We expanded that to 4 days, a Monday through Thursday, and 8 parks across the city for 9 weeks. So we always take 4th of July week off. You just never know what kind of staff you're going to get around the 4th of July. So took that up. Averaged 148 kids per week, about 1,400 kids total. So those could be repeat kids coming each year or each summer. So not sure, different kids, but that was just kind of the total. And then that came out to 108 hours of free programming. So the overall arching theme of it, our staff was bought in. They were having a great time, doing a really good job. There's a lot of setup and takedown, so there was some time in between. Long day for them. They were outside with no shade, but they did a great job. The feedback was tremendous of, are you going to be here next week? Are you going to be here next year? Are you going to expand? Those types of things. So those are things that we're working through right now to make sure that we can kind of cover the whole city or change a park or see, maybe we had some low numbers here. We need to do some more marketing, those types of things. And that was one of the interns was kind of in charge of that, getting supplies and providing rec to you. So really, really good summer for summer two. And then our full day camps, 13 weeks of summer, like I mentioned, it comes out with our full day, our Magic City Playhouse and Adventure Camp, our three main camps. Full day, we also run some aquatic full day camps as well. So Aquanuts, between that, it's 44 weeks total of full day camps between those specialties, and then the three main camps. About 1,400 participants with about 50 camp counselors, kind of covering all of that from the pools to North Park to Zimmerman Center, all over. So really appreciative of their efforts. They did a great job. And then sports camps. So about 1,000 participants around the camp. We couldn't do this without some partners. So our golf camp is run over by Matt over at Par 3. So really appreciate him working with us. Martial arts, we have an academy come in and kind of run those camps. So with that, we have our tennis academy, one intern, and then our sport camp intern. We supplement that with if they have a niche or a passion for soccer, then they would go, one of our summer camp counselors would go help out with soccer for that week. So kind of supplement that with our camp counselors. Our tennis instructors, we're running tennis camp. We ran it for 9 weeks, 3 different sessions for about 8:30 to 12 every day. But it's all over town. So we were at Rose, we were at Castle Rock, we were at Pioneer. So it takes a lot of staff to get that going, and then evening lessons with adults and kids, and then about 17 swim instructors. For the first time this year, we also ran 40 free swim lessons at South for 1 week. So Monday through Thursday, they could sign up. That was just the capacity that we could handle because of staff and time of year. And then some of our specialty camps, again, we rely on external instructors to be able to help us out there, and then we supplement that with 10 to 15 camp counselors. So, and then swimming, a lot of swim lessons that happened this summer. About 600, including 90 from the Friendship House. We had about, between South Park and Rose Park, about 50,000 people that went through the doors, and that doesn't include us because we were there every day. I don't think they counted us. And then dog days, we were blessed with 231 canines, and then their owners that day. So really good summer at the pool. And then there's just some pictures highlighting some of those. Adventure Camp would go over and scuba dive. Aquanuts would go scuba dive. So just some pictures for. So right now, we are back to school kickoff in the fall. This last weekend, we just finished our 5th season of Miracle League. And when I say 5th season, 2.5 years. If you remember, we started in August of 23. That was our first season. And then we move into the spring of 23, if I have those, or fall of 22. And then move into the spring of 23. So we run a Miracle League in the fall and the spring. So we consider that not just a year, but a season. So we just completed our 5th season this last week. 33 athletes, and that's adults and youth. And then the other adaptive rec program is the Love Serving Autism. And we partner with USDA Montana up in Kalispell, and then also the Big Sky Pickleball and Tennis Club. They provide the facility, and we go run the program. The intern that was awarded the Intern of the Year is actually our lead instructor for LSA. So she's been doing it twice, or for the last 2 seasons with us, but she's been with us for 4 or 5 years as a tennis instructor, flag football coordinator, whatever it may be. So really proud of those 2 programs in particular. Like I said, we just finished up this last week with Miracle League, and then LSA wrapped up last Thursday. We'll offer those in the spring and in the winter as well. ninth season of flag football. Right now we have, we're going into week 3 of games at Centennial Park. It is a madhouse there on Saturdays for the next 2 Saturdays. We use the north, so if you're looking at the parking lot, we use just the north field because it's flat, it's lush, but we put 3 fields on that north grass area. So it gets wild. We have 200 participants this year, and that's 38 more than we had last year. So really proud of the growth there, and we can expand to other programs. All the coaching is based on volunteers, so we do have the ability to expand. We just need to find another game day site. The one thing that the coaches, the flag football coaches, all the volunteer coaches are doing right now is they are participating in, I think it was June, we were awarded a grant through our national organization, NRPA. They had partnered with some coaching curriculum services in the country. We were awarded a grant for 50 coaches to get 1 hour of training, online self-paced module. The one that we were awarded was Positive Coaching Alliance. So all of our coaches are required to go on and just learn about, it's not about winning, it's about connecting with people and a great experience. So we're happy to report we've got 25 coaches already trained with that right now, and then we'll add tennis here in a little bit, and then move on to girls basketball, boys basketball. But that all has to be completed by January 1st. So really happy about that. And then right now we've got pickleball boot camps going on. Adult piano lessons just finished up. Pickleball open play at North Park. Wednesdays and Fridays are going on for an hour and a half. Adult co-ed volleyball is going on up at Castle Rock. That's a picture right there. We expanded to 28 teams this year. So we have, we're going from about 1 o'clock to 8 o'clock at night there at Castle Rock. So really appreciate the school district working with us. Table tennis at North Park. And then here in a couple weeks, we'll start girls basketball. Youth tennis lessons are going on right now. And then tennis is elementary at Meadowlark Elementary and Eagle Cliffs Elementary. And then in addition to the programs, these are some of the projects that we'll start working on. One thing I do want to highlight is I believe when we were here last, we kind of talked about we'd like to start a junior park board. So a group of high school middle-aged students that we could really give a voice to, give them a platform, bring them in. We don't know what teenagers like to do, so we're not going to assume that we know what they like to do. Get their opinion and get them involved in community activities and volunteering and that type of thing. I'll cut this story short, but we are now part of the Youth Volunteer Corps. It's a national organization that we just joined. So it's kind of geared towards 11 to 17-year-olds. And so we're in the process of meeting with kind of, I guess, our advisor with YVC and getting the lay of the land, building a website, and then starting to build out programs and different events that kids can join. So again, national organization that we're a part of now. The target market is 11 to 17, 18-year-olds with leaders in place to go, plant trees or volunteer at the Miracle League. So we're working through all those things. I have to give credit to Jake Milliron. He's the one that's what's behind that, our community engagement coordinator. So thanks to Jake for that. And then going back to April, starting to get some steam ahead on some STEAM programs, meeting with schools and seeing if we can get in the schools and do some after school type programs. Continue to work behind the scenes on esports programs, which you wouldn't think that's Parks and Rec, but it's very big around the country. And then starting tomorrow virtually, we'll go to our national conference. It's in Atlanta, but we're going to do it virtually from here. So get a lot of great ideas. We'll start on, the brochure is due, I don't want Allison to get mad at me, but I believe it's due Friday. So our November through April brochure is being finalized right now with registration opening on November 1st. So we're starting to do the back end stuff, get the registration open, pictures up on the website, and getting our app updated as well. And then once January 1st hits, we'll be kind of through with girls basketball. We'll jump right into boys basketball, city league basketball for adults. And then we kind of start the process of the second brochure that we have. So that brochure will cover April through November. So the things that we're doing right now currently with Miracle League and LSA and Tennis is Elementary, we start planning for that in January. Just because once we get through school and the summer starts, we are so dang busy. So we'll start that process, start getting requisitions out, start hiring people in February, March, getting our interns lined up, and then working on the trainings and getting that set up. So very busy once we hit January. We're busy year round, but January really hits the ground running. And then this is just kind of continued. The one thing that we talked about is trying to provide more services when school isn't in session. So Christmas break, spring break. So we're actually in the process of putting together 3 camps that'll happen during spring break, that first weekend in March. Really excited about Kids in the Kitchen, character design, martial arts camp. So working with getting those lined up and seeing if we can't get those during that spring break. It wouldn't be a full day camp. It would be more of a half day or afternoon or whatever, but something where the kids can have a place to go during spring break. And then we'll start to interview, hire, and train staff as we go. This is kind of a lead up all the way to June 16th. Aquatics, getting the pools ready and cleaned out. We're always looking for volunteers for that, always. And then Miracle League, Love Serving Autism, those types of things. And then hopefully launch the esports and some of the STEAM programs, or at least have some concrete stuff for the next fall. So a lot of layers to that when we're in the school district, figuring out who we can partner with and what we can do. So. And then this was a slide from the last presentation. So we talked about some of our goals were obviously to activate parks, get teens more involved. But as we break this down a little bit further, adding additional adaptive, inclusive, and therapeutic rec programs. One thing we did this summer was the swim lessons, the vacation station type camps with the breaks. We're going to have those 3 camps in spring break. Some educational classes. If you come over to the senior center on Mondays, they are lion dancing, and it's anywhere from Kenny G to Boot Scoot and Boogie. It's a great time. It's right outside of our office, so we hear every song. And then one thing we talked about with Jake, trying to provide more community events. So Easter egg hunt, a trunk or treat. We are excited. I'll get to that slide in a minute, but everything highlighted up there, those are things that we have in place or we've already done since April, or that are coming up very shortly. And then those are, just some breakdowns of really what our goals are, and getting out more in the community, providing more educational classes, activating parks, hitting the teen demographic type stuff. And then, I can sit up here and talk for hours, but really it's about the kids and the memories and the Magic City memories and the pictures. So these are just a few of our different types of camps out and about. Magic City, Playhouse, Aquanuts. I have yet to rappel on the rims, and I don't think that is ever going to happen. I'm invited every time we go up there, but I'm not prepared to do that. But I hadn't seen some of these pictures until we put this presentation together, but apparently they have a grocery store at Wise Wonders. So the kids got to go, and we've got a cashier and buying groceries, and I just assumed that those kids went to Kids in the Kitchen and then got to cook the spaghetti over there. But we like to get the kids out and about. Well, we don't want them cooped up at their homes every day. Like to take them anywhere from Red Lodge whitewater rafting to Bitterroot Sip and Paint to all over town. The list is endless. We have a master list of just kind of places we go. Get Air, the bowling alley, just trying to get them out and about. And I think one of the neat things is the ability to go to Red Lodge there. Skate World there. We've got one of our tennis camps. I think the with the 3 weeks, the last Wednesday is always Wacky Wednesday, so they can just come and dress as much as they want. And then the bottom picture, the kids actually learned how to write their name in Japanese. So we had an outside vendor from, or a guest lecture instructor from MSUB that was here presenting a class, and she was able to come down with the kids and do a lot of neat things. And then ice cream's always good, so we've got that going on as well. And then we talked about the trunk or treat. So on October 27th, we are partnering with the Blue Skies Pediatric Therapy Clinic. We are having a all-inclusive trunk or treat there at Landon's Miracle Field. So we had our site meeting today. Really excited about that. If you haven't been to a Miracle League game, it's an hour of organized chaos, but it is a great time. That picture up there is actually opening day of Miracle League this season, and then the pictures below are at the Big Sky Pickleball and Tennis Club, and that is our Love Serving Autism program. It's very therapeutic. It was developed from a gal who was a ex-tennis player, but also a therapist, so she combined her two loves to provide this national program, and we're really excited to be able to offer something so specialized like that in Billings. So excited about the trunk or treat. And with that, I'll open it up for questions.
Thanks, Dan. Very impressive. A real fire hose of projects. Amazing, whatever, 70 different programs. So appreciate what you do. I'll start us off, and maybe we'll go down here and just kind of work this way. But I saw a couple references that you were maxed out, or the programs were full. Is this... is that the situation? Are we leaving kids that are unserved? Is there more demand than we have supply, I guess? And if that's the case, what would you need? What's the bottleneck to serve even more kids? Or do we have adequate resources and our problem is getting the kids to take advantage of those resources?
Yeah, I mean, I think it's a combination of all. I think it's facilities, it's staffing, but at the same time, we can utilize our parks. Like North Park, for example, it's got things in it 3 or 4 times a week, but we can certainly, kind of expand on that. I don't have a great answer for you because I think it's just a combination of staffing, timing, facilities, space is limited, so or instructor specialty. So character design, we have one instructor that came to us and said, I really want to teach us. And we asked her, what do you need from us? I need supplies. Well, how many kids do you want to limit to? Well, for me, I can only take about 10 kids at once. So we try to convince her, well, can you do two sessions? Well, no, I'm not available. So with seasonality, it's a little bit tough to get, I shouldn't say commitments, but there is that I'm a college kid or I'm a high school kid. Well, I have vacation here, so I can't be here. I can be here, and so you're trying to figure out this.
Okay. All right. Thanks, Councilor Rips. Start down here.
Sure, thank you, Mayor. Dan, Corey, Austin, Mike, I mean, you guys know I've been involved in this for 10 or 15 years. The growth in our rec programming, just in terms of the breadth of what's offering, the creativity of what you're doing, I mean, kudos to you guys. This is really exciting to see, and it always is every time we get one of these rundowns, but it just seems like we're taking it to another level now, so thank you guys. The Miracle Field, I don't get out there often enough, but when I do, it is always a great time. If you guys haven't been out there, come out and see it. It is wonderful, and it's inspiring, and just it's so good to see, and thank you guys for putting in your time to make that happen. One of the things, as the Miracle Field was kind of being designed and talked about, there was always some talk about, can we do like Wounded Warrior programming, senior programming, adult programming for people in wheelchairs or whatever. Are we going to start seeing some of that? I know that's, at the end, you got a long list of potential things you want to do, but I'd love to see us use that field more and more for those types of additional programming.
Sure. Yeah, no, I definitely think those conversations need to be had because it's not just Miracle Leaguers, adult or youth. I mean, it's a ability to reach wide open spaces or even have the surface is not very sliding friendly. But I did drive by the other night and there was a massive kickball out there and there was a group of people playing out there because obviously it's an open public facility. And so it was great just to see other people out there playing. But yeah, certainly open and want to have those types of conversations to get that park in particular more access and more activity.
Thank you very much. Coming down here, Councilor Boyette.
Thank you, Mayor. Have you ever thought of getting a shuttle service for Amen Park? Every time I try to go on a Saturday, I can't find a place to park. They're on the curbs, gutters, they're parking upside down, sideways. I physically can't get in, which is really good. That's not a complaint, it's just an observation. But is there any thoughts, future plans, or what can you think we can do about, I mean, it's crazy as you've been there.
I don't know if I should take that one or turn that over to Corey.
Yeah, Councilman, Mr. Boyette. So that's the YSA, the Yellowstone Youth Soccer Organization, that has the big Saturday soccer days at Amon Park, similar to like the YMCA up at Castle Rock. If you've been by there on a Saturday, it's busy. Or now if you go by Centennial Park, it's really hard to park there as well because we have our NFL flag football program there. So again, that's a conversation we can definitely have with Mike Mayotte down in Amon. But yeah, additional parking on Saturdays for YSA, I think has been needed for a long time.
Thank you. Councilor Joy.
Thank you, Mayor and Council. And I would just like to say that Jake is really doing hard work because he was down at the Gardener's Market selling vegetables from Amon Park Community Garden, but I don't think we should count on that as being a future funding stream, just saying.
And he was working on Refresh the Rooms on Saturday as well. Councilmember Roy? Councilmember Denise?
Thank you, Mayor. I noticed you said you're going to be debriefing on some of these programs, which looks like you had a great summer. And a lot of kids, of course, there's a lot of kids in the city. I don't think we impacted very many of what is in our city. So I think to Mayor's point, there's probably room for more to reach out to kids. But I guess some of my questions I'm going to have, I'd like to hear, and you may not be able to answer this tonight, but you know, what percentage of these programs do we know are actually city residents versus out of non-city residents? Do you have any kind of idea of what that is?
Yeah, we can certainly provide that information.
Okay.
You can get that.
Okay, that'd be great to hear. And then also when we're looking at this, how are we helping families of low income be able to participate in these rec programs, making sure they can get signed up? They're not disadvantaged as far as I understand these programs. Once they come online, they can get sold out right away. So how are we making sure that everyone in the community has access to some of these programs?
Yeah, I mean, I think that's one of our challenging things is with our partnership with School District 2, we're able to get flyers out and do our activity guide and our brochure. But once it gets to the schools, we don't know if the teachers hand them out and that type of stuff. So we need to figure out some things, social media or that type of thing. We do have a youth scholarship program that goes into our activity guide to make sure that people know that that's an option. But yeah, we need to start thinking a little bit more outside the box. If it's not just flyers, do we have some volunteer groups? Our YVC, for example, our 11 to 17-year-olds, can we get some groups together and have them go speak at schools and say, hey, this is what we got. Get in with the PE teachers, those types of things, just to spread the word more at school. We do that for Miracle League or some of that, get into the adaptive PE classes, but think outside those things. Those are some of the things that we've talked about internally of doing.
Okay, and then do you keep track of as far as how much you do in scholarships or what you provide to low-income families as well?
Yes,
okay.
we do.
All right, and then if county residents or out-of-county residents versus city residents, how much more do they pay for the services versus a city resident?
$10? Yeah, 10 per program.
$10 per program? Okay, are you familiar with how the Public Works charges the county residents or out of area residents?
Yes.
Okay, because they're like 50% more.
Yeah.
And because I know that, as a city residents, we're funding that a lot. Do you know if this rec program is actually paying for all of the costs for the program, the equipment, all of the staff?
Yeah, I mean, we have a pretty good idea. Our cost recovery would be in the,
So we're covering all direct costs.
yeah,
All direct, but not indirect costs?
Correct.
Okay, and so that's where a fee schedule would maybe help. Has there been an increase in the fees to this program year over year?
yeah, I mean, it depends on the program.
Okay.
So some programs have increased, some have not.
Okay,
But, yeah.
all right, thank you.
Thank you. Councilor Gill?
Just great work. I enjoyed as a kid a lot, youth sports and soccer and basketball very good, but you guys have those camps that would have been really a lot of fun, so glad our kids have this.
Yeah, thank you.
Councilor Shaw?
Yeah, just great job. I love seeing all these numbers, and you're making a big difference and impacting a lot of families. So as everyone said, if we can go bigger, awesome, eventually, but good job. It's really exciting to see.
Thank you.
Very good, thank you. Anything else from council before we invite public comment? Don't see any, so Dan, thank you very much.
Thank you.
This is an opportunity for public comment. If anybody's with us who'd like to comment on item number 2, the Parks and Recreation update, please come forward. Is there any public comment on item 2? Any public comment? No one is coming forward, so I guess we'll close the public comment period there. Gentlemen, thank you. Again, thank you for your hard work, and keep it up. That concludes item number 3, or I'm sorry, item number 2. Item number 3 is our draft strategic plan. So Kevin will try to bring that up, and I'll turn it to Chris to introduce this item. So, Chris.
So Mayor and Council, as Kevin's pulling it up for us and what you've had in your packet.
And Chris, I'm sorry to interrupt. Council, we're close to 7:30. Does anybody want a break? I'll probably just keep going, and you can just leave if you need to. Feel free to do that. Okay. All right, very good. So go, turn it back to you, Chris.
Not new information, but sometimes it's helpful to have a piece of paper in front of you. So this will be fairly brief because there's not much changes from what you've seen over the last several sessions, although Victoria really helped us to, thank you, Kevin, beautify it, make it more user-friendly. So as you know, over the past year, really starting with the adopted set of goals from 2022, we did our retreat. This is the 3rd work session conversation we've had since that point. And I just want to highlight some of the changes from what you saw before to today, because they're pretty straightforward. They're really just fall into 2 buckets. So in working with the Family Justice Center Alliance, those are the folks who came to Billings and worked with us on the development of that master plan and that process. They gave us some, I think, great recommendations on objectives, both short-term and long-term. So overwhelmingly, any adjustments you see in this, I think with one exception, came straight out of those conversations. The other thing that drove is with shorter and longer term, you'll see that it now says 2025 to 2030 as a 5-year window that we're looking at. So focus really being on the strategic goals, the objectives underneath of those, and candidly tonight, rather than going over them, that you've had them, you've seen them, we're here to answer any questions and or find out, are we ready to put this on a regular agenda for adoption? Or do you have specific changes you want made to it before that takes place? And Mayor, I'll turn it back to you.
Okay, Chris, thank you, Chris. How would you suggest we talk about this? Rather than jumping from goal to goal, if I just turn it to council member, I'm afraid that might be confusing. I guess my inclination is to try to go goal to goal and try to wrap up a discussion. Any problems with that? And let's confine our discussion, council, to process at this point before we get into the details if we can. Councilor Rasmussen?
And again, kind of to that process, from my perspective, if we're looking for a motion to move this to council, I'd just as soon put a motion on the table, let's vote on it, and let's move this to council. We can have discussion based on the motion. If anybody wants to make amendments to this, then let's do it. But I mean, I think we have literally beat this horse to death. So if that's the process, I'd just as soon make a motion to put this on the appropriate council agenda as determined by the city administrator, and we can have discussion about any comments or changes as a part of the process of that motion. So,
Okay, so it sounds like you're okay with this as it is.
I am.
Okay, good. I guess he said he's willing to put on a motion. I didn't hear the motion. A little bit depends on how much people want to dive into the details.
I'll make a motion to put this on the next available council agenda as determined by the city administrator.
Okay, lots of seconds, so that's the direction we would head in. So now we have it on the table. Further discussion on that, either is it okay or you want to make specific changes? In which case we'd kind of have to make probably formal votes on it. Councilor Absalon?
Just to speak to my motion, I really appreciate Katie and Ben working through the Family Justice Center Alliance to really kind of hone in some of those things. Brought up some really great points when we did that. I think this is a lot better format than it came the first time. Gavin, I appreciate your effort in working this together. I think we're really close to where we need to be, and I don't see any problems, but I appreciate the effort.
Very good, thank you. Councilor Shaw had the second, then Councilor Boyette and Councilor Bernice.
Thank you. I certainly agree. I'm ready to move forward with this. If people have specific changes, that's fine. I think we can consider it, but going through it point by point seems like kind of a waste of time at this point. We've done that multiple times. And I like that it's moving to 5 years. I think it's taken quite a while to get where we are, and we're going to have to start all over again if we do a shorter time frame. So I think this is a good time frame. I like that Victoria prettied it up. I say we're ready to vote and get it on the agenda.
Okay, thank you. I'm just going to point out there's still a typo on page 5 that I'm assuming will get fixed as part of the project. Is that where you're going to go? Okay. Where it says increase city general fund by $400,000 a year. Of course, we do a lot more than that. What the goal is increase city general reserve fund, I believe, right?
That is correct. In the prior versions you saw, and that is exactly it. That was omitted, not deliberately. That was a miss.
Okay.
And if there's.
And that covers
it's still
Councilmember
omitted on
Boyette.
that one. Okay.
Councilmember Bernice, you also had your hand up.
I did have a question, and thank you, that was about that. So I don't recall us wanting to increase the general fund $400,000 a year. That's what I was not sure about. But if this is a strategic plan that we're approving now, I mean, we can't bind future council what we're doing. So are we only going to look at this every 5 years? Is that the whole idea?
No. No, the idea is we understand with clarity as to what the priorities of the policy body are. This isn't the only thing that we work on, but these are the priorities. And as far as binding future councils can choose at any point in time to change priorities, change direction, but you're saying this is the focus for the next 5 years. And that's not to say we won't look at it again for 5 years. That'll be up to this body as to how often you want to refresh or reconsider the document. We as staff will report back to you, whether it be quarterly or semi-annually. I would certainly suggest not more often than quarterly, not less than semi-annually, on the progress that we're making on these objectives.
So just to be clear, your intent is not to review this every year?
I think ultimately it will be up to the council as to whether you want to change, adjust annually. I mean, we have had over these past 6 years that I've been involved, we have had an annual point at which we look at what is on the table.
Okay, thank you.
Councilor Rowan?
Thanks, Mayor. I think I generally agree, assuming that we understand we are increasing reserves by
Yes,
400,000, not
absolutely.
taxes by 400,000.
Yep.
Then I only have two concerns, and they're pretty straightforward, so I would just throw them out for discussion. I'll make a motion if I need to. I think on these last two bullets here under reduce, addressing juvenile justice and mental health only through legislative action, in my opinion, is too narrow, because we already are and can do prevention work. Now, perhaps the prioritization is simply to focus more on legislative action and continue our community collaborations and partnerships. So if you could speak to that, that would be great. And then the next one that I would throw out on page 3, which is goal 3, we continue to narrow the Skyway Drive and Billings bypass too much, in my opinion. I would ask that we say land use, infrastructure, and economic development strategies, since that is the amendment the council adopted. But if you want to just speak to either of those, Chris.
So let me talk to the first one briefly, which is, we did make a tweak to that, thinking about our legislative action, not that nothing else would be approached, but those would be some specific areas over the next 2 sessions where we can make some headway.
I think that's fine.
I'd ask if the team wants to add anything more, they could do a lot better job than I could in that. But we felt it was too broad, candidly, when it came just saying that we were just going to focus on that broadly.
Councilman Rowan and Chris, would it help just to put the word including in front of through legislative action? So legislative action is specifically mentioned, but it's not exclusive to only that.
Yeah, I think that would be great. I also acknowledge that Chris's point is right. I mean, we can't have a plan that does everything. And if what the gap in our current strategies is that legislative piece, I don't mind prioritizing it. I just think there's so much more we could do with community collaborations and partnerships. I don't want to lose that.
Sure.
So, but yeah, saying including legislative action in both bullets would be fine by me.
Yeah, go ahead, Ben.
Thanks, Chris. Good evening, Mayor, Council. Ben Halverson with the city. So I just wanted to explain why we went with a 5-year window, specifically with these domestic violence metrics. So for example, getting a victim to get out of an abusive relationship and our efforts to prevent that victim from being re-victimized by the same abuser or a different one, that takes time. They might go back a number of times into different abusive men, and we're always looking for the next time. We're trying to keep those relationships and maintain them, no matter how hostile or compatible they may be throughout the process. The other, I think, more important example, a lot of these conversations we've had with Director of One Safe Place in Fort Worth, Ken Shedder, and one of their metrics through their One Safe Place is they measure the number of youths that they serve each year, and over time, correspondingly, delinquency numbers in the youth justice system are supposed to decline as they have in Fort Worth. Obviously, we can't make that happen today. There are a lot of moving parts to make that happen. Creating independent legislation to respect the victimization of a child who's witnessed an act of domestic violence is part of that process. But that would be one of the things that we can't fix in 1 year. And in fact, it takes about 1 year in total to get a baseline for where we need to go moving forward. So that is why that 5-year window, and I don't want to speak for everything else because that's way outside my wheelhouse. But I just wanted to leave it at that with the 5-year window.
Yeah, I think that's great. I have no objection. Chris, did you want to talk about the transportation piece?
I think we have no pushback at all and agree. The intent, you guys gave some direction earlier, we just need to capture that in there relative to the inclusion of, I think it was economic development.
Yes, please.
Yes, will do.
Thanks, Mayor.
Okay, thank you. Councilmember Neese?
Thank you, Mayor. Chris, digitizing the records, we're not going to take 5 years to do that, are we?
Yes, because we've been trying to do it for 2, and
I know we've been
we're on
trying
our
to do
third
it. It is going
person.
to take 5 years, okay.
Yeah, and that's not because we want it to take 5, but I will tell you, we're on our third full-time person. That individual hasn't started yet, but we're excited about him, and it's been a process to have someone lead that. We had some really great traction in the beginning, but honestly, for the last roughly year, I would say, we've really struggled to fill the position and get moving.
Would it not be better just to hire an outside company to come in and just do it for us?
Not necessarily, because there are fits and starts that go with that as well. And then ultimately, what we want is not only the digitization of the information, we want it to be accessible to both internal and external customers. I mean, the organization has to be able to use that data and collect it and get at it, and we want citizens to be able to do the kind of things they're accustomed to through search engines and other things to gain access to all of our public information without needing assistance. So making sure that's done right and consistency across the system is important.
An outside company couldn't do that.
Well, I'm not saying an outside company can't, although I think at least in the last stages when we looked at that, the dollar figures were astonishing. I think the police department alone was into 7 figures. Kevin?
Yeah, we got a bid for just the police department records, and it was upwards of over $1 million to do it.
Okay. And we're going to be able to do this within 5 years for less than that, I'm assuming?
That is
One
what
person?
we are.
That's our goal.
That is certainly our goal.
All right, thank you.
Very good, thank you. Councilmember Kenny, Councilmember Ripsis?
A couple of things. One is improving the safety of Billings for all citizens. I know we talk about reducing all of these, reduce, eliminate, maintain, enhance, improve. We don't have anything about adding more law enforcement. So where does that come in here?
I would say those fall into our actions of how to accomplish the objectives. So
I just want it as a matter of record because that we did talk about this and that it's implied that we would have to increase our numbers.
I get Councilmember Kennedy, what I would say is, what I would expect is frankly a full push and pull from both the policy body and the staff for all of these. One could imply one solution is add resources to everything. That's how we get things done. We don't have enough resources, just add resources to everything. So there's going to be this budgetary process and other things that determine when and where is it added resources that are going to make that happen, efficiencies that are going to make that happen, or changes in how we deliver services.
I
that are gonna make
understand that.
happen.
I just want to make sure it's out here so people understand and that it's not written in here, but it's implied.
Sure.
On goal number 2, sustain and upgrade critical infrastructure. We wanted to increase the number of airport passengers and Billings air cargo. Build and upgrade. Why are we talking about the airport as an airport authority? If we're going to look over the next 5 years, why don't we add that in sustaining and upgrading the critical infrastructure? Because that we've talked about an airport authority. Why wouldn't that be in here?
I guess I would suggest that in and of itself could be an objective, but doesn't necessarily need to be an objective. Ultimately, we have this objective of more passengers and more cargo. Whether the authority is a path to enhance that or not, that is on our action steps as an approach going forward. If you want it specifically called out, it can be.
I think for the next 5 years, it should be in there somewhere. I would just put that out there. And on the on page 4 there, provide exceptional educational, recreational, cultural service and amenities. I think the one thing is, if we're going to increase the trail network, we should, as the objective, it should be increase the trail network with private partnership.
Okay.
We don't have the money to do that, and there should be some private partnership with that.
So, Councilmember Kennedy, what I would suggest in that case, and you guys please correct me, however you want to work forward there. I mean, I would think that might be a really good consideration of an amendment, whether that be tonight or the night of adoption, in that, because I think if you say trail network through, private partnerships, You're being crystal clear. That is not, you're not looking for additional public funding, grants or otherwise. You're looking for, that is how we're going to accomplish that. And that clarity is appreciated on the staff side if that is the policy direction of this body.
And that would be, the last one is goal number 5. The city general fund, increase it by $400,000 a year. I would hope that we're not, just like Councilwoman Owen said, we're not looking at property taxes.
Yeah, Mayor and Council and Councilmember Kennedy, and my apologies there. If you look at all of the prior iterations of this, we clearly missed the word reserves. And that was not omitted deliberately. So it was about growing that reserve, as you recall, Director Zeller talking to you about how close we are relative to cash flow and things like that. So it is not meant to grow the general fund expenditures by $400,000. It is recognizing that there is a value in growing the reserve, not just for reserve's sake, but cash flow and other things.
And so I would just say, we have some amendments ready for when it goes on the regular agenda. Thank you.
Okay. I would encourage anybody to think about what amendments they might want to offer at a later date. Councilor Ripsis and get back to Councilmember Neese.
Thank you, Mayor. And Chris, first off, thank you for your response to the stated implication that goal number 1 implies that we're adding more law enforcement officers, because I think you're right. There's a lot of give and take there. A lot of these things would not necessarily be affected by more police officers, so I don't think that is an implication of these particular goals, and we shouldn't read it that way. We should have that conversation when we get to specific action items, like you said. So thanks for that clarification. With the improvements on the domestic violence side of things in terms of measures or more actionable objectives in those descriptions, I think it kind of makes reduced violent crime and reduced property crime sound kind of trivial. If we don't have anything specific there that we want to target, I think we should take them out. Or if we want to target, auto thefts, we should target auto thefts. I think it's just kind of absurd, not absurd, but just kind of trivial to just say reduce violent and property crime. It doesn't really reach that level of specificity that the rest of them do. On number 2, we have this optimized efficiency of the transportation system. Incredibly vague. We can optimize the most efficient transportation system might be 100% public transit. Or we might go completely opposite way and say, you know what we really need are 5-lane highways throughout all sections of town so everybody can get everywhere as fast as they possibly can. What does optimizing that efficiency mean? And I think, we want to leave ourselves some flexibility, but to me, that is just so ambiguous that it doesn't provide necessarily the level of direction that I think we would hope to get to there. So if staff has some thoughts of what they really meant by that statement, that would be helpful. Otherwise, I think we need to dig into that one a bit more just so we have some clarity of what we're really expecting over the next few years. On number 3, we have this housing strategies to address strengthening and stabilizing of neighborhoods. That sounds nice, but again, I don't think it's specific enough. We have housing affordable issues in a certain part of the market, the low and moderate income side of the market. We do not have housing issues at the market rate to high end of the market. So to me, if we're going to have a strategy over the next 5 years related to housing, it should be specifically targeted at that low to workforce, moderate income kind of strategies where we really need some help, either intervening in the market, supporting the market with the low income, or providing incentives or whatever for workforce, starter housing, those types of things. Additionally, targeting housing instability, crisis response, our network there. It's not very complete. We've heard over and over again, we know we have an issue right now, at least with low barrier sheltering, response as people start either approaching or entering housing instability situations. getting our partners to work together and acting as a facilitator or whatever role that the city should be playing there. I think that's a strategy, something we need to do related to homelessness over the next 5 years. It's shocking to me that it's not in there at all, given the challenges in our community. So I think we need to address that there. Number 4, if we're talking about a 5-year plan, I really think we need to say, have something in terms of addressing the shortages and inadequacies in our physical facilities, recreation facilities, courts, ice, aquatics, tennis, pickleball, those types of things, indoor facilities, through the use of private partnerships, as Councilmember Kennedy, indicated. Those are going to be very important as we have been talking about what to do at Amen Park. If this is truly a 5-year plan, I think putting something in there related to that development and moving that forward is critical to include. And then nothing to say on number 5. So those are my thoughts on that. Thank you.
Very good. Councilmember Nish, you had your hand up for
I did.
And then Councilmember Joy.
Thank you, Mayor. Regarding, I hate to go back to this, but I'm going to, the reserves, it wasn't just a couple of weeks ago, Andy talked about the reserves, and I don't disagree the reserves may be too low, but he had kind of recommended, he thought the percentage that we have is a different amount. And so I'm not so sure this is the best objective to look at, because is $400,000 the right number? That's one of the few actually specific goals in here for 5 years. So we're talking, over the 5 years, we're going to do $400,000 a year. That may be enough, that may not be enough. And so I think that having the objective to fund our reserve properly based upon what it should be. And again, I haven't heard that those, I haven't heard good evidence from Andy to say why we need to increase it more. And I think that has to happen before we even say it's 400,000 more.
So Mayor and Council, Councilmember Neese, actually what you're saying, I think there's significant value to part of this discussion, all of it, but in particular, when Andy put this here, we were on 2 years. So I want to say based on current numbers, we were thinking we're about 800,000 short, not that we're $2 million short. So if you're amenable to it, I think it would be more proper to put it as a percentage. And I think that's what Andy, that's what other cities that I've worked in has had that target percentage, because that ties directly back to cash flow and bond ratings and things like that. So we'll adjust that with your permission. You'll see something different in this when you see it on the agenda for adoption, and we'll just change it to a percentage to be consistent with the dollar figure that we've been talking about for the past many months.
Right, I think that as long as we have good evidence of why we're changing the percentage, I think I'm fine with that. And then I have to agree, as I look through this as a strategic plan, there's so much vague information in here, and just about anyone can interpret this one way or the other. And so I'm not so sure. I thought we would hear more from the experts out there and say, okay, if we're going to do this, this is what we're going to do in the next 5 years. And yet I don't see any real numbers unless there's going to be a document that has more details behind this somewhere that we're not seeing. I sure would like to have seen more specific, this is the goals in 5 years, what we're going to do in these areas. But
my response would just be this: let's not let perfect be the enemy of good, and recognize we're evolving from a point in time just a few years ago where we were just listing, in all due respect, a task list of things to get done, and evolving over to a set of goals and a set of objectives. And yes, this does not include our action plan to accomplish those objectives. That is work that staff will do. And I do think over time, probably that annual conversation or whatever, 18 months or 2 years, whatever the future council wants to time it at, it would be valuable to more and more refine these objectives to be clearer about, again, what the direction is from the policy body. Thank you.
Okay, thank you, Councilmember Ripsis.
Just one real quick that I forgot. Number 3, update subdivision regulations. I think we're supposed to adopt those next week, so it probably doesn't make sense to have those on our 5-year
Come
plan.
on, we can't check a box on anything that
They'll be done before we adopt those.
You are correct. We do have them on next week's agenda for adoption.
Okay. Council member, go ahead. Councilmember Jordan.
Thank you, Mayor and Council. I mean, in terms of goal number 3, fostering economic vibrancy, and you come down to develop, Councilmember Rupsis was talking, housing strategies to address strengthening equity, desired density, and stabilizing neighborhoods. That, I think, captures the idea of what we're looking for is how that housing crisis is impacting that affordability issue. You can very easily address that with more of an equity word. And in terms of our land use, part of what we're seem to be working towards is that desired density. So I think that equity and desired density could be something that would really strengthen that and make it more specific to how to stabilize and strengthen housing strategies. Thank you.
Councilmember Jordan, would you just restate, I think you were proposing a possible edit there.
Yes.
But I missed the details.
Okay, housing strategies to address strengthening equity, desired density, and stabilizing neighborhoods.
So add the words equity after strengthening and then desired density after that.
Yes.
Okay. That's not part of the motion at this point, but it sounds like when we come back with this, we would become armed with potential edits. Other comments here? Council Member Aspliner.
I think the intent of my motion was to get this on the council. I mean, we've had some debate. There's some good cleanup stuff that staff can do. If you want more specific things that, language such as public-private partnerships and things like that, then I think we need to come prepared with amendments to this document at the actual regular business session. And then we can vote those up or down and we can pass this on. So I would, ask that we take a vote. Let's get this on the agenda and then come with your amendments if you have amendments to this document.
Thank you very much. I was going to make the same suggestion that any possible amendments be circulated in advance so that you have a chance to actually look at them, think them through, write them down, and I think that would just be very helpful rather than popping them at the actual meeting. So very good. Councilmember Neese, before we move to a vote on the motion on the table.
I am going to vote no against this motion because the reason we have work sessions is actually to work through things and make changes to documents that we have for us. So I am going to vote no because I don't think business session is not the best time to be adding amendments and going over different things. So I won't support the motion at this time.
Very good, thank you. Further discussion, there is a motion on the table for approval as drafted, but we've already heard some possible amendments, which, again, the recommendation is those be circulated in writing in advance so people have a chance to think about it. Maybe they'll go away, maybe there'll be consensus. We can kind of work that through between the meetings. Council member, go ahead.
I just wanted to clarify what you just said. The motion is to advance this as written, not to approve it as written, right?
I apologize. Advance it to our regular meeting.
Okay,
Yes.
thank you.
Yep. Very good. Any further discussion on the motion? Councilmember Rupsis.
I just completely agree with Councilmember Neese. I'm going to oppose this, not because I don't want to be done with this, but just because I think it's better to hash through these potential amendments in a work session rather than a business session. And it looks like this is the last thing on the agenda for, I'm sorry. No, I was looking at the subdivision regulations. Whenever this is, I would, if we're going to try to hash all this stuff out in a business session, hopefully we just do it early on while, people still have the attention span to talk about it.
Okay, there's a motion before us. I also would like to see probably some changes, but I'm ready to just move it ahead. So, and it is hours getting late, but I appreciate staff's work on this and other council members' work on it as well. Any other discussion before we proceed to vote? Okay, motion is to put this on an agenda as is, with the probability that there'll be some amendments proposed at that business session. If in favor of the motion, please say aye. Aye. If opposed, nay.
Nay.
Voting in opposition, council members Neese, Joy, and Ripsis. Motion passes, and we'll look forward to it on a future agenda. And there was no limitation on that. That was still in staff's prerogative. Okay, thanks very much. That concludes item number 3. Highlight upcoming agenda items of council interest. Chris.
So in addition to this, I would say we're getting closer to bringing the capital improvement plan to you. It's coming through Budget and Finance Committee and then on to you, but that is an extremely important fall and early winter public policy discussion for you guys. So I would just highlight that in preparation, and when it gets out, that you review it and come prepared to engage in that dialogue. Again, it doesn't allocate funds, but it is extremely important because we use it and roll it in immediately to the next year's budget process as what was adopted in the capital improvement planning effort. So.
Okay, very good. Thank you. Council discussion. Would anybody like to discuss the meaning of life or other things on your mind? Councilmember Boyette.
So October 17th is the Boards and Commissions Volunteer Appreciation Dinner. So Mike Yakovich self-appointed me, and I've been stuck with, I've been working on it diligently. So Councilmember Rupsis plans to be there. Do I have any other volunteers? So we get the same crew show up on the 17th. Be there a little before, it starts at 6, so show up before that.
Very good.
Or did you buy what you were supposed to buy?
Not yet, but I'm on it. We'll get her done.
All right. Thank you.
Public comment on non-agenda items. There is no public left to comment, I think. So with that, we are adjourned.